We were hoping that the conference would firstly bring a lot of people together, secondly get them to talk about the things that were really important, the things that they needed and the things that would help them to do service user involvement more effectively, and thirdly some way of putting that together into a national network, something that could be greater than just the sum of its individual parts, something that could build on local strength and pull itself into a strong national force, something that would be much more difficult to ignore.
It's been such great, because I think this is where there is a big gap with service users conferences. I mean, you hear of the professionals have their conferences all over the country in the trust and the social service, but it's very rare that you hear of a national conference, and I was just chuffed.
I think the biggest thing we can get out today is to work together and use our skills and experiences really positively to come together to form a national network.
You know, if we went into Westminster, I think that would be such a breakthrough for us, really good breakthrough. You know, and I'd love our organisation to be part of that.
Everybody's got frustrations about the services they use, and I think it's kind of getting to work together to actually improve services. And I think that's the whole point of user involvement, is to get people to get together, say how they feel, and just work as a group to try and change things to their benefits.
I think for me the biggest challenge, and for the service user movement indeed, the biggest challenge is that we use the talent and the skills that are out there. We don't need to create something different, we need to coordinate what already exists. And there's a sense of urgency, because with the deficit that the NHS is facing at the current time, it's very urgent that we ensure that the government doesn't think that mental health budgets are a soft target. We have to ensure that what we've already got as far as service delivery is maintained and improved and not taken away from us. So it's not an option not to create that leadership and not to link together and not to ensure that we're providing leadership and very, very clear messages.
There's 173 of us here today, and from the return census forms, I can tell you that 50% of the people came here today because they were supported to come here from their service user group. 30% of the people here today came because they're part of receiving services from the voluntary sector, and the adverts that went to the voluntary sector were distributed and people have been supported to come. And the other 20% have come because the local NHS workers or the PCT workers let people know this conference was on and felt it was important that people came. And so we have 173. That was as of Monday. That might be different as of right now. I do. We've got a very great privilege today. We've got Frank Mangay, who's agreed to come and open the conference with poetry. And Frank has been a survivor for many years and been really active. And I think it's important that people like myself and others in the room who've only been around, say, 5-10 years, we learn from people like Frank who've been active for so many years. And it's only because of the work of Frank and others who came before us that we're in the position that we are today. And I'm part of a group called the History of the Service User Survivor Movement, and I've learned so much from the struggles that went on before I was active. Frank was a member of Prompt, which was active in the 70s, and was certainly a leading person in CAPO, which stands for Campaign Against Psychiatric Oppression. And we have to get our message across in various different ways. And some ways will be poetry, some will be art, some will be through campaigning, some will be through tactics and negotiation. And it's a real privilege that we have Frank here to open the conference. I said to Frank that I would introduce him in this way, and that is that the Black Power movement had the Panthers, the women's movement had the suffragettes, and the service user survivor movement has Frank.
The part about communication is called MAD. MAD! Or just trying to express so many things, flying through the world on a pair of battered wings. We're talking patois, we're trying to understand each other, as drugs cause communication problems. There are personalities that matter, so please try to listen. Please try to listen. Please try to listen. Sometimes we're stressed out and lost in ourselves. Sometimes we're drunk and staggering about. Sometimes we're tanked up on psychiatric drugs. We mumble, we slur, we stutter. We stutter, thoughts get fragmented and scattered, and things could still make sense if only the human race had a little patience. So I'm struggling down the street with my Tesco carrier bag full of worries, sometimes carrying shopping, sometimes carrying poetry. I'm struggling down the street with my Tesco carrier bag full of worries. I'm anxious for the day, my friend. So are you, so are we. Gotta keep anxious for the day, gotta keep anxious for the day, gotta keep anxious for the day. Alright, mad, or just trying to express so many things. Our wings may be battered, we keep flying, we won't give in. Many times chattering conflict, sometimes we miss each other, there's usually too many differences. We have pride, so much pride, we will fly, we refuse to be pitied. Oh mercy, can we ever find the space to listen?
It's important to include work that other people have done through the years in order we can learn from it. And the work of HASCAS was very thorough. It interviewed an awful lot of people who access services and carers. It had a report that was really, I think, robust and solidly researched. And I think we'd be foolish not to use every tool available to us. And therefore, the tool of the HASCAS report was a tool that was available to us, and we needed to use that. And it was really good that Tina was able to come and articulate the findings of that work.
We did a review of user and carer involvement in NIME, the National Institute for Mental Health England. What I'm going to tell you about is what we did, the key findings about user and carer involvement in NIME, recommendations that came out of that. Because it's a user carer review, we got in user and carer associates, and particularly tried to recruit people from geographical range, because we wanted to cover the whole country, and bring people together with diversity within the team as well, so that we can try and think about all the angles. So what did we do? We did what is technically known as a literature scope, which basically look at what's out there in terms of user and carer involvement, what's been written, and there's huge amounts. I despair when professionals say, oh, how do we do this user involvement thing? There's loads of stuff written by very good people, and you guys. We also had interviews with key stakeholders. Okay, another bit of management balls there. Stakeholders. Anybody had some connection with what was going on. We sent out a load of questionnaires. We got about 250 back. We also held focus groups, because obviously not everybody wants to fill in questionnaires. We had questionnaire to death. We invited comments from national organisations, and we had a reference group which we had meetings and updates, to talk about what was going on, to make sure we were on track. Okay, so the good news. What's working well? There is a breadth of involvement, hurrah. There's also capacity building. We'll hear about that again today, another management term, but it's about enabling and building up people to be able to do stuff effectively, capacity building. So some of that going on. But, NIME haven't done quite so well in terms of relation to diversity of users and carers. And there was also a lack of accountability. And somebody used the phrase usual suspects. You might be here today. The usual suspects turn up at all these things. And I think that's very true. And the key to this, that user and carer, user survivor and carer involvement is not integral to the work of NIME. That's what we found at the end of May last year, which is interesting because their sort of core mission statement is users are at the centre of what NIME does. It needs to be something that isn't an add-on, but something that's done separately, or is managed by one person over there. It needs to be something that's threaded through all that happens. So there's some underlying ambivalence about user and care involvement. And what we mean by ambivalence is sort of indifference. So, yeah, it's okay, you can sort of take it or leave it. And there's some interesting stuff when we interviewed and talked to people. In terms of dynamics, you going to the table with people in suits, I don't know, so I took one off. Somebody used a comment about, sometimes there's skillful dismissal They know that they're being dissed, you know. They know that they're being pushed aside, but done in a skillful way. They still know it's David, but it's done in a nice, sort of skillful way. Skillful dismissal, I think, is a wonderful comment. Now, EBE, experts by experience, which is a term that is sometimes used wider to describe people like ourselves, people with wider disability, as having experiences and therefore are expert in their own experiences, or EBE for short. But we have an EBE group as part of NINE. And so we talked to them as well, and we talked to other people about the EBE group. And people said, well, I think there's a sort of lack of transparency, particularly around recruitment. And we also said, particularly the EBE fellow who's here today, we said, hi Jan, is it doable? To be fair to Jan, Jan's been around a long time. You know, I take inspiration from Jan's work. And Jan is rightly, you know, an EBE sort of national fellow. But, you know, we said, Christ, she got too much on her plate. Okay, so in terms of findings at regional level then, there was variations investment in terms of, you know, what money was put in. There are examples of positive and creative sort of initiatives. There are, good stuff. But there are also tensions between national objectives and local needs and perspectives. There is some representation on management boards, and there is some embedding across programmes in terms of diversity. Now, in particular, people who have the title of user and carer sort of leads for regional development centres. They had some decision-making accountability, and for some of these people, they weren't actually a budget holder, which made life very difficult for them in terms of some practicalities. And maybe there's a conflict of interest in terms of who they are and what they did. And sometimes that can happen with us when we're put in, you know, awkward positions. But there was also some good, you know, support and good employment practice around people who were users, survivors and carers themselves in these roles, and in terms of their needs and being enabled to do this work. Interestingly, and interesting for these people specifically, there was a difference between salary and variations between all of them. They did know that, so they all get paid slightly differently. It's a bit contentious. But there's some good personal and career development stuff, and in terms of capacity stuff going. Capacity in this case, good. Okay. That's really, you know, what we did. And as I say, there was a team of users and carers, and at the beginning we were giving a small pot of money to do this. And then our boss was very good, because she listened to us and we changed the whole thing, went off and did all sorts of exciting things that cost lots more money, didn't it, Sally? Yes, and they coughed up for it, which was good. So we need to have, you know, a clear purpose and outcomes. You know, users and carers want to know what they're doing and why they're there. And there also needs to be accountability and influence on decision making. We need to be able to make decisions. Clear processes, again, a developmental model. We need to enable people to be able to take part, and so there should be supporting mechanisms, i.e. things there to help us take part, various things. We need to reach out and broaden our diversity and cross barriers. We also need to connect and strengthen existing networks. And this is for NINE, but think about what we're doing here today. Today is about connecting things up a bit better and strengthening and having a national network so that we can support one another. So capacity building projects, and one of the things we talk about leadership development. Now the South East Development Centre have been running and are running a leadership development project for users. Anne was young and quiet and retiring before she went on that project, and now look at her. We also need a single payment policy. I do this stuff because I work for HASCAS a couple of days and I do other sort of bits and bobs. And you spend so much time negotiating how you can get your hands on the money that they owe you. It's unbelievable. And we really do need this in NINE. And excuses or reasons, well, because we contract with a trust and they do pay users or don't pay users, or they do it this way or they do it that. And it's inequitable. It's not fair that if you live in one area you get that amount, and you live over the road you get something else. You know, NINE have taken it on board. A bit of a bitter pill to swallow maybe with some of it, because it's not all happy. There are some good stuff, and I think the will is there. So when we reported it back, they said, okay, yeah, let's draw it up. We've got an action plan. There's a guy whose job is solely to take it forward. It's a man called Liam Guilford. Do you want to stand up and embarrass yourself, Liam? He's here. I think he's quite user-friendly. He's going, oh God, they're going to mob me now at lunchtime. Now, this may sound a bit Blairite, but there is something about rights and responsibility. If you give people the right to do stuff, we've got the responsibility to make it happen. Now, I think that this time is right. We can really now make this happen. There's lots of stuff going on. There's wonderful stuff going on. We need some cohesion, so that we don't have to keep telling the same story and explaining ourselves and telling people we should know better why using the care enrolment is important. The NHS is horribly overspent. They're saying something like, I don't know, 200 million, although people are saying it could be as much as 800 or 1,000 million, 2,000 million, 1,000 million. I'm not very good with figures, you see, just trust me with money. So 1,000 million, I can't imagine that sort of money. That is huge. And that really worries me. And you guys know that that's happening at the moment because all the day centres are under threat and you're out campaigning at the moment because people are saying, oh, we've got to close stuff because we haven't got the money for this. So the NHS is in deep doo-doo. So we must use today, to be very positive and come together and really take this stuff forward. Because if those guys are making a mess of it, we can't do any worse than that. So as soon as the lunatics take over the asylum, the better. That's what I say.
I'd like to thank Tina very much. It's very important that we do know we've got some intelligent people within the movement, and people who were once shy can speak up. And it isn't just a case of saying to the NHS, you're 1,000 million overspent. It's really a case of saying, because you are 1,000 million overspent, you need us. How many of us know which services are so awful you could shut them tomorrow and only 3 people would be upset? It's what we replace them with. We have to replace them with the things that we do need. And to be honest, apart from one guy, in the last 8 years, he wanted a red Lamborghini and felt that was the only thing that would suit him for his recovery and didn't understand why it wasn't on his care plan. If we wrote our own care plans and were supported to write our own care plans, whether you're on an enhanced care plan or not, the sort of solutions and the vision that we know helps us is cost effective. The system itself, the bureaucracy is unbelievable. There's somebody else at a meeting with, and I was sitting next to her, and that was about the NHS finance. And I said, I need training. I don't understand this NHS finance. And the chief exec said, well, if you go on it, can we come too? So you can get a bureaucracy that in fact takes more energy and more talent and more intellect and more commitment to keep that going than it does to support us in the way that we know is possible. We are not asking, all of us, for a great deal. We ask for so little, apart from the guy who wanted the red Lamborghini, which he didn't get, which in a way maybe he should have done. There is a thought I've had, and I've discussed it with people who hear voices, that when the voices are really troublesome, and they can be so troublesome, or that the thoughts just will not leave you alone. If you wore a mobile phone with a headpiece, and you had a Saint Laurent, what's an expensive suit, Armani suit on, you'd get away with it. And the solutions often lie with us, the individual solutions. The solutions often lie with colleagues who've been through very similar experiences. The solutions are not often costly and expensive. The system has had its turn in trying to support us. And frankly, it's just not working and it isn't doing the job. We need a vision. We need to seriously create a leadership. We need to be spot on today, to be extremely inventive in how we get the resources to keep meeting today, so we can get people who use forensic services to say what would assist them. We can ask the youth, what do you really need to ensure that other people your age aren't going to get into kind of distress, and if they are, they move through that process quickly. We don't need to cower away and say, well, we'd ask you for money, but we know you haven't got any and you're having trouble. This is the precise time they need us. We are the untapped resource. We have the solutions. We need to now really be strong, grit our teeth, and actually go for funding and finance, because the NHS is overspent.
I think lots of attempts have been made over the years of developing a national voice, but we don't have a voice on the ground. There's service users I know in my area who don't have a voice.
On a local level, you're not really aware of what's happening on a national level. And if you've got a good local group and you can then band together all the local groups, you will naturally get a cohesion which goes up to national level, hopefully.
What I would like to see is from top to bottom to work 100% closely together, because I think we're all working on our own.
The thing is, we've got to actually get organised. And it's like, I was talking to the boss earlier, and apparently I've got unions in Holland for mental health service users, and I think it'd be quite good to get that kind of cooperation and unity together.
I can see some of the appeal of a national group in that it would sort of hike mental health issues up the agenda. I'd be concerned about whether it had teeth or not. So if it was just going to be a national talking shop, that would be disappointing, in fact. So it would be interesting to see how it would link with the Department of Health and the powers that be. But certainly I could see that there might be some appeal to have that, because I know that lots of groups across the country, we all talk about often the same issues with sort of perhaps local slants on them, and then about not reinventing the wheel, and I think there is perhaps quite a lot of duplication of work and input and angst over sort of common problems and challenges. So it could perhaps, if it was well organised, be a way of perhaps moving things forward, hopefully quite dramatically.
For the next session, I just want some really brief feedback from each of the workshops, and I'll call them up. If we could have Group Blue.
As you can see, we came up with quite a bit. Top three things were Service User Union, independent funding, and the Service User Union would need a website and teams listening to and acting on real objective service user voice. And lastly, work with the Department of Work and Pensions, Office of Parliament and Housing to reform benefits, making them work for mental health. And that's in the voluntary sessional, so people who are working voluntary sessional, part-time, full-time, receiving training, and during the changeover period between benefits and employment or education. And that's us.
Excellent.
Training needs money to fund it to happen properly, and when we are a trained force of people, we need the resources to pay for the expertise that we bring. We're worth every bit as much as people who are so-called professionals in the field. We have our own expertise, and we all work differently, and we all come from different backgrounds, and we need to recognise and value that. Some people will want very small bits of bite-sized training. Some people will want things that are wider and more all-encompassing. So we need to be flexible and to meet people where they are in terms of their training needs. That's us.
Existing services to be publicised and advertised so that more people are aware about them. We know where to go rather than just being shoved in a dark corner. Professionals re-educated, service user self-help, like buddying and mentoring, because I'm sure quite a lot of people might think that this is a good idea. Who wants to sit in an office most of the time speaking to somebody who's never actually really been through the things that you're going through, doesn't know what's going on in your head? Come on, if you can sit down with a group of people and actually speak about the exact same things, know that you're not alone in the world, then that's got to be better than any medication that they can throw at you, right? Yes. And then listening to young people, which you've all done very well at so far.
Whatever this thing, this entity is, this sort of network, I think people were clear it needs to be user-ran and user-owned. People said, worrying about the host agency, who that is and who they might take over it and blah, blah, blah. I think if it's user-ran and user-owned, and it's whoever helps needs to know that, but also it's important that this network is, democratic and accountable to its network member.
And independent.
And independent. See, interesting, right? Exactly. All those things. And that we need a clear sort of mission, obviously, and vision. I talked about management bollocks earlier, but there is a lot of good stuff in management bollocks in terms of having a good mission statement, so that we all know what we're signing up to, and have a good vision. I'm all up for visions.
I think the principles set out by Jan's report, by the HASCAS report, by the work that Emily Brown has done for Together are really important principles that should form the foundations for any future network. They help to make sure that it's sustainable, that it's hasn't just come out of the ether, but it really is based on a lot of work, a lot of research, and the passion and commitment of an awful lot of people.
Okay, so this is what a network is, what it isn't type of presentation, to clarify some of the issues that have come up so far, and to address some of the concerns that I think all of us have had in how we develop and where we go from here, and there have been other suggestions around as well that haven't been picked up or haven't been taken forwards, and looking at why a particular way forward would work particularly well for us as service users. Okay, firstly to say that it's not about providing a national service user voice. We need to recognise and address and manage the fact that there will be external pressures for a national voice. People coming to us saying, what's the network's view on whatever it is, and we need to manage that. We need to recognise, and we do recognise, that other groups, organisations, individuals are doing that on different topics, across different groups of people, and across different geographic areas. A national network is not a representative body. A national network would support existing groups. That's the power of the network. It's not one organisation replicating or taking over. It's about supporting groups and providing support to each other within that network. There are very few issues that haven't been addressed before, but currently it's hard to make those links. It's hard for somebody in Lancaster to find out if someone in Surrey has been doing a pretty similar piece of work already, and how they came across, how they found their own solutions. It's a bit hit and miss. Like I say, the issues have been addressed, but the solutions aren't always the same. What the network can do is to provide those links in a much more coherent way, so that organisations and projects can learn from and use those solutions that have been found elsewhere as a starting point. A network would link groups around a particular topic. For example, organisations have probably been to each one of us and said, can you do me a piece of consultation work? And it has to be a really thorough piece of consultation work, normally by a week last Friday, or if you're lucky, a month's time. Okay, and it's really difficult to do that. We can say, yes, we'll do what we can within the next month or a week ago, or we can contact our contacts, our limited networks as we have them at the moment, and it's really hard to do that in just a month. A network would provide more infrastructure to do that, so if we already have the information, we don't spend a month trying to make those links already. We've got the links, we just send the information out. So a national network wouldn't be an overarching body that implements policy and practice. Groups develop their own structures, their own aims, their own ways of working to meet their own needs. Groups need ownership of their own processes of developing and reaching these solutions. A solution or a policy implemented by another group, even a service user-led group, is not much different to it being done by an agency without us, which is one of the things that we've said all the way along needs to change. What a national network would support groups by providing a library of policies, examples of what's worked, so the groups will still have ownership, but it has easier access to the ideas and suggestions that can get them started on the way. It will be important to us to find a balance between principles and values, but also not having a particular policy line. For example, all groups need an understanding of equal opportunities, but they won't all be achieved in the same way or have the same equal opportunities issues to address. A national network will need somebody to be doing that. It will need workers. But these workers will not be the national service users providing the service user voice. Workers for a network would support groups, that would be their role. They do that by keeping an eye on policy, finding out about new developments and initiatives that may help or hinder involvement, issues that come up in mental health in general, that network members want to keep abreast of and be involved in. At the moment, it can be really hard to find out what's going on. You hear from a person fourth or fifth hand, and suddenly actually the event was 2 weeks ago, so it's too late. If we have people who are specifically keeping an eye on what's going on, up to date with consultations, that they can then send the information out straight away and solve some of these issues around timing. Workers will keep in touch with existing groups, building and updating databases of groups, building an awareness and the network's awareness of who has particular areas of interest, who has particular areas of expertise. So these are some of the ways that a national network can support and strengthen an infrastructure within the service user movement.
It normally takes in excess of 12 months to organise a conference on this scale, and to say that your team have done this in less than 2 months, basically showing up the so-called professionals, it shows the real strength of service users, and it's an inspiration to all of us really. It shows what can be achieved.
Towards the end, we'll pass the credit on to where it really sits.
With your grouping of different, say, BME or different sort of groups, and you filled in the information out, say consultations out, then effectively it's going to be coming back through the network, and you're going to be passing this information on, hopefully to engender change in services. You are going to be implicitly the service user voice. And why is it such a bad idea anyway? Because in coming together, aren't we hoping to have more change, more effective and meaningful, lasting change more quickly by joining together?
Thanks very much. I think what we were trying to illustrate is we don't want a few individuals to claim they are the voice. If people need to be discussing what it's like to be a Muslim woman on an acute ward, we'll ask women who are Muslim on acute wards to have their voice. It may be we support them to get their voice heard. What we want to move away from is that a few individuals can actually have the authority of a huge diverse community, and we have got to work together.
How will young people be supported in the networks? That hasn't really been made very clear. I wouldn't really know what to do if I was going to go out right now and try and put together something like this, or try to just to get somebody to hear my voice. Then how would I do it?
Okay. Well, we won't answer that here and now. I mean, I for one think you've done an exceptionally good job today so far, and I think. The short answer is there are lots of things that we can do to offer training and support, and just talking to people who've already done it. From my own point, I started hearing and seeing things when I was 14, and there was nothing you could do about that except go to your GP and get pumped full of drugs. If that had happened 10 years later, I might have been able to talk to hearing voices.
It's still the same now.
Yeah. Well, we'll get more info. I mean,
nothing's changing. It's just more people are finding out that nothing's changing. That's all.
Okay. Well, I mean, you know, it's fair to say that not a huge amount has changed in some respects, but the fact that you can come here and say openly that you hear and see things, the fact that people can gather together on a national level, is something that we really can build on.
But would we be saying that if non-mental health users were in the room too? That's the difference.
I think the short answer, we need to continue discussion, is we need to provide resources for youth so that you can be the chair of a subgroup to go and kick arse.
Thank you. Alan.
The network will be only as good as the link between people on the grassroots. And one of the things I realise when I go into wards, when I go and visit people on the wards, actually their connection to the youth movement is miles away. Yeah, they don't know about the youth movement, they don't care about the youth movement. All they care about is is stop being injected in the bum, stop being thrown into seclusion, stop being, the right being taken away. And I really think that if we actually say that we want a user movement or a user network, we've got to actually listen to the people who are actually not in the network. That's why I think we need to think about having local strategies locally. Now we develop strengthen networks locally first, then build up. And then we've got trust. So I think that the whole history, things that we've been avoiding, I think, talking about, is trust. Trust and representation. So I think that's a very important issue. Because I think actually, if I'm going to have someone representing me, me or whatever, I want to trust them.
We seem to be doing two things today. We're both designing how the network's going to work and how we're going to have parallel threads of youth or whatever else flying through it at the same time. And the second part of what we're doing is trying to work out what that network will do when it's there. If we're implementing both of those things at once, can we have an assurance that when the network is in place and information is flowing through it and requests are flowing through it, if those requests at that time are not the same as what we're saying today, that the people who are already employed there, making the things we're saying today happen, will not be offended when they're asked to do something different and will allow themselves to be influenced and controlled by the elected representatives.
The point is well made, and a lot of this we will not know what the effect of this network is until we start doing that, and I think it's entirely reasonable that it will develop over time.
The question I'd like to ask, and I'm sure others do, what's today about, what's our answers, and where do we move forward?
Right, is there a commitment from management to listen to young people's views and act on them? Can they prove that they will take notes? Not treat it as a paper exercise, and their filing system is the bin, because young people don't know who to trust and what part of the system to trust.
I think the point is that the people who experience mental distress we're a very diverse community. Some of us have learning disabilities and therefore will need support that's suitable for them to have their voice heard. But what's interesting for me is that you've got a room full of people who are prepared to sit and listen and support. And that room full of people is us here today, and perhaps we need to be showing professionals that they need to learn from us. And so I think there's many mediums we can use to get our voice heard, and a network should ensure that it's robust and forceful in ensuring that everybody's voice is heard in an appropriate way. And if people don't want to listen, we need to be explaining that that's really a problem they have, not us. The other question about how do we get management to listen, well, there's many ways, some more pleasant than others, and some tactics you use first of all, and if they don't work, you go on to other tactics. And it's not, I think again, we listened to you, and maybe it wasn't easy for some people to speak today, but I feel there are many tactics that we can learn from across this room. All of the people in this room probably have had some experience of not being listened to and determined to go back and get listened to the second or third time. And we need to share that experience with youth and with everybody who needs that experience so that we do get heard by the top bosses. And it's not just the top management, I would actually argue it's government.
In the last 3 weeks, I've been in a number of meetings where people have complained just how difficult it is to get young people to express their views. I've got their names. But seriously, I'm going to be going back to a number of people and saying, it is not good enough to say it's difficult to get young people to speak. It's incredibly easy if you do things properly. Yes. And if you listen, and if you respond, and if you make some kind of effort to show that there is any point in people expressing their views. One of the things that we're pleased about is that the conference brought together a lot of people who'd used forensic services, and they often get left out of service user involvement. People say it's too difficult. People don't really know quite how to do it.
I'm very glad to say that there is some representation here today from forensic mental health service users, and thank you very much for coming. It's not a group who get heard very often, and I would like to see in the future their presence here as well, up front telling us about their experiences. I've had the honour of working with groups of forensic mental health services users over the last couple of years and have seen them doing inspirational work. Very early stages of service user involvement in this area, but there are people who are breaking new ground and doing very important work, and I think that needs to be heard. The other group are people who have mental health problems but are denied services, or who find that the services that are on offer are not services they wish to engage with, who end up getting in trouble and end up often within prisons. And I'm not talking about a small number of people. When we look at prisons, we're talking about 60 to 70% of the Rwanda population of prisons has at least one mental health diagnosis. And large numbers have 2, 3 or 4 diagnoses. We're talking about a very, very big problem. I work for an agency called Revolving Doors Agency. Revolving Doors alludes to the fact that the agency works with people who go in and out of the criminal justice system with mental health problems. And I want to say something very, very briefly about our service user involvement to give a picture that actually things are happening within a voluntary sector organisation like that, and things that I think are important to hear. And actually I think my colleague here on my left is probably in a far better position to say something very briefly about service user involvement in this sector. So we're going to do this by me asking a couple of questions, and I'm going to ask Matt. Matt, how did you get involved in service user involvement?
Well, first of all, it's just I got asked to do it by one of the workers there, and to be honest, one of the main reasons that I did it was for the money, because I needed the money more than anything else. It wasn't out of the goodness of my heart. But, well, actually, it was a little bit out of the goodness of my heart. I wasn't that desperate for the cash, but 15 quid did come in handy. So it was just basically being asked to do it, and just saying how much it would help as well, what I could actually achieve by doing user involvement, by the training and stuff like that. So it wasn't just the money, although I did say that. And I'm really sorry, I can't shut up sometimes.
All right, no, I'd like to hear a bit more actually, because I mean there's a lot of things that happen. So I mean perhaps you could tell something about some of the good and maybe some of the not so good things that have happened since you've been involved in service user involvement with Revolving Doors Agency.
Well, some of the good things that have come, I've actually been trained to actually give talks at conferences like this. Obviously the training weren't that good, but you never know. But I've been given training for that, also training on giving people interviews for everybody who's involved, who's employed by Revolving Doors, has actually got to be interviewed by a service user on the panel, except obviously my job, because it would be a conflict of interest. But there are a lot of pros to user involvement, especially now I've got this job. And it did take a while I've started working to actually gain the respect of the fellow service users, because they still saw me as a service user and not a member of staff. But now that's changed, we've got some more members. I'm actually given that respect, and I've actually got a lot of respect from the staff at Revolving Doors because I've got the personal experience of being in police stations, I've got the drugs experience. So if they want to know about drugs, they just come and ask me.
We were able to get some funding last year, and Matt is now a member of staff, and a very valuable member of staff within the organisation. Because as an organisation, we're not just about providing services, we're actually far more about trying to engage with wider discussions and engage with the government. And being able to understand how that works is also incredibly important. And we are able to engage with the Home Office, engage with the ODPM, Office of Deputy Prime Minister, and with the Department of Health, and try and influence them. And I think we need that kind of knowledge as well. So having a very a mixed organisation with a very diverse staff population, I think puts us in a strong position to do that. To finish, I'd just like to say one thing. The reason I came to here today is because of the initiative about setting up a network. And especially for small service user groups like the one at Revolving Doors. This is incredibly important. We're talking about a group of service users who are already very isolated. But also it's important to feel that as a service user group, they are also part of a wider service user movement. We hope that the initiative of setting up a network would increase the opportunities for that. So coming here today is about, not just about talking about it, but we would like to see some action that's moving forward so that we can say, actually today is actually a point in history that we can look back at and say something started here that is going to make a difference for the coming years to the service user movement as a whole.
Thank you very much.
The importance of Jan Warcraft's work is that it was the initial document that brought together individuals to look at the whole idea of a concept of a network. And because of people's powerful allegiance to their own local groups, it was the one way that we could get all those groups to come together. I think at this point in time, if we tried to get people together under one banner, one headline, one group, we would have failed. The time isn't right for that. And the whole concept of a network which utilises the powerful loyalties that people have to their local groups is a huge step forward, and Jan was the author of that.
David mentioned sort of talking about the network, the honour and terms being called it Jan Warcraft vision. I don't think I could quite claim it's my vision because it's based on this report where we did go out and talk to about 300 or 400 service user groups. You can download it from the Sainsbury's website. You have to go on to www.scmh.org.uk, click on the heading Publications, and then scroll down till you get to Honour and Terms. Okay, so about the vision, there is a vision. I think what Emily described the actual structure of what a network should be and not be before the break was absolutely spot on. That is what I would hope, that it should not be seen as the voice of service users. Every service user group can kind of sign up to and say this is something which we feel is doing what we want. That all those groups can be networked via this network, so that they can. The planners, when the planners want a representative, that the right person can be found from the existing groups who are signed up to it. So it won't be speaking on behalf of users, but it will be directing the people who want to use a voice to the right place to find that. And also trying to build capacity so that people are better able to get their voices heard. What else? Oh yeah, the other thing about being a voice is that we need to kind of get the service user movement to discuss some very key issues, and some of those were raised in this report. There are probably lots of other issues, but a couple of the crucial issues are things like what we think about medication. Are we for it or against it? Obviously there's a wide diversity of views about treatments, different kinds of treatments, but we need to have that debate and find out what we've got in common about that. And even more important, what do we think about pharmaceutical companies coming in with funds and trying to offer those to service user groups? There's a huge diversity of views on that, from give us some money because you've taken, you've made money out of us, we want some of it back, to over my dead body I will sell my soul if I take a penny from the drug companies. And we need to have that debate out in the open, because at the moment what's happening is people are stabbing each other in the back over it, and it's going to destroy the user movement, split it right down the middle and make people hate each other. If we can have that debate in the open, perhaps we can end up with some respect for ourselves and for each other. I think it's a really crucial issue that we debate nationally. Second one would be mental health legislation. I would say we need to talk more about that. I don't know what's happening with the current mental health bill. Maybe it's not going to resurface. Maybe it's going to come back and hit us and bite us in the bum. I don't know. But we need to talk about what we want from mental health legislation, so we've got a service user perspective, if that's possible, on the issue of what kind of law we want to see. National voice, a series of voices, many voices, training people in media skills, like the work that David was doing in mental health media. Here we've got people with masses of media talent, you can just tell from talking to people, they've got plenty to say, they just need their confidence built up so they can go and say that to their local journalist, to their local media, or to the regional or to the national media, and we can actually get a real voice that even the Sun can't ignore. We need to be in the national newspapers saying what we're about, so that we can. That's going to be the quickest way of eliminating stigma. We could do it in 6 months with some decent media training. I really believe so. We can make sure that any TV programme that wants to represent mental health issues has to go through this network, and get authorisation. Otherwise, they'll get endless sort of streams of complaints from service user groups, which could be kind of orchestrated around the country. Like, you do not portray something like that. You've got to do it. They don't go ask Marjorie Wallace to get SANE to advise, and they come to our networks. That's the sort of vision I have for it. Finally, my last bit of my vision is that we start to develop our own alternatives. The government's sponsoring the expert patient programme, which is fine as it goes, but it's not specifically for mental health. We need something which is more mental health oriented, or which builds on the EPP or builds on what the existing organisations are doing. Why can't Rethink and Make Depression Fellowship get money to roll out their programmes, which are excellent programmes and specific for the people with those particular issues? Where's the money for the things that are coming from the user movement? But you could abolish most of the mental health system if you just gave people the money to create their vision and then give that something back. And I think you could just stack it in alternatives. I should stop there while I'm winning.
The real challenge is to include everybody. Now, it may be that people's views will conflict, and that's fine, and that's probably healthy. In fact, it is healthy. But where people's views conflict, we need to ensure that we've got a system that's robust enough to make sure that everybody's views are still included, still heard, and still put forward. The coordination of lots of groups is not an easy task, but the biggest challenge is to coordinate and include.
I think for me, the secret of success for any national network will be constantly bringing in new people, constantly getting new people involved, constantly getting people to both move from working locally to regionally to nationally and back the other way. We will make sure that the network is as diverse as possible. I mean, today we have about 100, we've had a bit of an argument, but we think we've got 153 people here. But even this 150 is only a small cross-section of the numbers of people that we will be getting involved over the next weeks, months and years. Everybody here that I've spoken to has said, what's going to happen next? What are we going to do? How are we going to take this forward? How is this going to be not just words but actions and deeds? In everybody's pack, we gave you the basis of the network built up on a sets of principles and a bit of methodology from the work that Jan's done, from the work that I've done, from the work that Anne's done, from the work that lots of other people have done. We accept that the detail will adjust, the principles will develop, the ideas will develop, the network will develop over time. But is this a good enough place to start, and do we have your approval to take this forward and get some money to do that? So could I have a show of hands? Those who are in favour of us doing that from here. Can you do a little bit of pre-counting? Okay. And all those who are against? Okay. And undecided? What do you want to do, Anne? Yeah, okay.
I just want to make a point about OOT. I think it's a marvellous piece of work, yeah. And why has it sat on a shelf for 3 years? And that's not Jan's fault. But the point is, the work is there, out there. We've done all the bloody groundwork, and we're still sitting in rooms talking about it. We need to go back to our groups, go back as individuals, and say, OOT, we want it, give it to us. I know, and this is
Okay, it's a term for on our own terms. It's a shorthand, which is the document Jan introduced. Nick, did you want the microphone?
I can do if you want. This morning, one of the workshops was on this document. There were amendments proposed. Will they be incorporated with the document?
Yeah, we can do that.
That's what we're voting on.
Yeah.
Okay. Good.
There's a lot of people undecided. There was about 20, I would say. There was definitely about 6 people who were very much opposed. The majority were in favour of the work continuing. This isn't finished by any means or stretch of the imagination.
We have a real chance to change the climate. We have a real chance to create a network and to create a platform for a really wide range of voices. This time we can have something that is genuinely different, that is genuinely reflecting the diversity of the service user experience, that gives everybody a chance to have their say, that gives people a chance to work together in new and exciting and creative ways. That really does make a difference to not just to mental health services and not just to mental health policies, but actually to people's lives.
Oh, in a year's time I want to be part of a network that's bringing about positive change for all sorts of people, for people who probably without the network would feel hopeless. The network will give a lot of people hope. They'll give a lot of people their lives back again. They'll give a lot of people a chance to reacquaint themselves with skills they've got, and it will give a lot of people a bright future.